suffer from frequent headaches. People think that stress and loud noise are usually the main causes of a headache, but that's usually not the case. The origin of headaches, more often than not, tends to stem from the neck and shoulder area. Tightness can cause misalignment in the vertebrae of your neck, thereby causing pain. With a typical headache, a person feels the pain originating at the base of the skull and then moving up to the temples, eyeball, and forehead. Gentle neck and shoulder massage treatments can release tension and help relieve headache pain. Chiropractic adjustments can realign the vertebrae in your neck to treat the root cause of the headache, usually caused by poor posture. This is by far the most holistic approach to treating your pain. We have years of experience helping other patients treat their headache pain. Let us help you finally put an end to yours. Contact us today for a no-obligation consultation.
All right, so tell me what's going on.
So I've had lower back, I wouldn't call it pain, but it's kind of soreness for a little while now. And I thought it was like something major, like a slip disc or something like that. But I went to the doctor and got an x-ray and everything was fine.
What kind of doctor and where did you go?
Oh, it was actually in Korea. It was
Okay.
a general doctor, so they took like x-ray and they did a test where they bent my leg up and stuff like that. I don't know what kind of doctor it was. Maybe it was like a physical therapist type of doctor. And then it said it was fine, but I still experienced some soreness usually after working out within 2 days or so. And most of the time the discomfort comes from when I'm bending over like this, or when I go down to tie my shoes, or when I sit for periods of time.
Is it bad in the morning when you try to get to start your day, and does it feel sore and it takes a while to get going, or is that okay?
It's sore in the morning, right? Yeah.
And it gets better throughout the day?
Exactly, yeah. Actually, even when I go to the gym and I work out and I do certain back exercises, it's after a while, after I warm up, it feels a lot better.
Yeah, because it loosens up.
Right.
Okay. When you walk, does it aggravate the symptoms, or it's okay?
Walking?
Yeah, walking.
I never feel it when I'm standing up or walking.
Okay.
Yeah.
And when did you say did you start experiencing these problems?
I've had this problem for, I want to say, I've had it once about 4 months ago, and then it went away for a little while, and then when
now
I came,
it's back.
right.
Now, in terms of this low back pain, do you have any shooting pain down your legs?
No, not at all.
No, so it's just local?
Right.
Is it on the right, on the left, or more in the center?
It's right. It's on both sides and down the center a little bit.
Okay.
Yeah.
No shooting pain down your buttocks?
No.
No? Okay. Cool. And what would you say the level of pain, 1 to 10, 10 is the worst pain you ever experienced?
It's probably about a 5.
5?
Yeah.
And since 4 months ago, do you feel like it's getting a little bit worse? It kind of stays the same?
It's probably, I've gotten better at managing it, I think.
Okay.
Yeah.
But it's still there?
Right.
Okay. Obviously you wouldn't be here.
Yeah. Also, one more thing I guess to note is
Yeah.
the one thing that I've been doing that's been helping it feel a little bit better is I've been holding onto a bar and hanging, kind of like dead hanging.
Yeah, it works as a distraction.
Right.
What it does, it decompresses the discs between the vertebrae.
Mm-hmm.
So it kind of like opens up the space. So if you have potential pressure on a nerve, or if the joint out of alignment, and basically each joint has the receptors, they call mechanoreceptors and nociceptors. So nociceptors are the ones that send the pain impulse to your brain and tells that there is something wrong. And mechanoreceptors are actually sending the impulse to the brain telling everything's function normal. Okay? So in your particular case, when you hang, the joint decompresses, and that particular part of the joint that's out of alignment kind of goes back into space temporarily because there is no pressure.
Right.
You're just hanging, and and so you feel the relief. Once you stand back on your feet, there's compression again,
and it hurts.
and you're back to now. So the only way to fix it is realign your spine and put things back to normal, the way you were
Right.
before you start experiencing these problems.
Right.
And that's pretty much it. You
Okay.
know, it's pretty straightforward.
Yeah.
You
It's
know.
a pretty common problem.
It is.
Okay.
It is very common. A lot of people don't keep their form during the gym,
Mm-hmm.
and I see a lot of injuries of you know, young people that you know try to be in shape, and
Mhm.
instead they just you know break themselves up.
Yeah.
A lot of people try to do things they're not trained for.
Mm-hmm.
Like experiencing people trying to do yoga, and they look at the people that have been
Yeah.
doing this for years, and
Yeah.
they try to like put their leg over their head, and then they rip their tendon. And
Yeah.
same thing with the lifting. People look at people who've been doing this for years,
Mhm.
and then they try to lift heavy stuff,
Yeah.
and their body doesn't have enough strength to support it, so they don't keep the proper form, and they injure themselves.
Okay.
So you gotta go easy first. Build up your core and stamina and strength,
Mhm.
then it can increase.
Right.
It's very easy to injure yourself with,
Right.
with the weights, especially if you do free weights.
Mhm.
Machines are okay
Yeah.
because you have a control.
Right.
Free weights is you can injure yourself.
Yeah.
I've done it. I've done it few injuries myself. You know, when I didn't do the right way with the kettlebells.
Right.
So pull a couple of I mean, nothing major. It was just a muscle. But you know, with heavy weights, you can do quite a bit of damage if you don't do it right.
Mhm.
Okay, so with that being said, so let me go ahead and
Right.
take your jacket off.
Yep.
Let me see what's going on with your spine. You can put everything on the chair. Yeah. Oh, there's a hanger over there.
Okay.
I'll just put the chair.
Yeah, I can just drop it. So go ahead, have a seat.
Yep.
Okay. So even though it's just your lower back, I'm going to check your entire spine
Okay.
because the entire spine it's all interrelated.
Right.
Okay, so you don't have any range of motion on your left side. It's really like, you know, any pain around here?
A little bit.
Sore?
Yeah.
Any soreness around here?
No.
No. Yeah, the middle back is locking up on the left.
Mhm.
Let's check your lumbar spine, which is your major. The lumbar spine usually has two components.
Mhm.
Lumbar spine itself,
Mhm.
and I have a sacroiliac joint.
Okay.
Okay, bend forward, please. Back. Forward again. Okay. So go ahead, stand up, please. Okay, close your eyes, march in place.
March in place?
Yeah.
Okay.
Okay, stop. Keep your eyes closed, don't move. So as you can see, your right side is about 1.5 inches lower
Mhm.
than the left side. And then your right shoulder is about 1.25 inches lower.
Mhm.
And then your right ear is about 1/2 inch higher.
Mhm.
Left side. And then, let's see. Your right foot is externally rotated. Go ahead, have a seat. Okay, hold this, please. She should be here any minute. Okay, do you have some coffee? Okay. So this is what we have in terms of your spine.
Mhm.
So this is where you're at. So basically your spine is, this is like assuming perfect positioning.
Mhm.
So the pelvis, which is this, and this is the sacrum, which is foundation of the spine, the right side is about 1.5 inches lower, so it's kind of like shifted like this,
Mhm.
okay? So makes one of your legs shorter, one of
Right.
the legs longer, because legs are attached to you in this also called acetabulum.
Right.
And then your lumbar spine is compensating,
Mhm.
and it's locking on the left side.
Ah.
Okay, so when this is off balance, and spine is a gravity dependent structure, what happens, the rest of the spine is going to start compensating.
Right.
Okay, so that's why your left shoulder is 1 inch higher, 1.25 inches higher than the right one,
Mhm.
and then your right ear is about 1/2 inch higher than the left one.
Interesting.
So what we're going to do, we're going to adjust you in 4 different spots. We're going to adjust your right sacroiliac joint,
Okay.
lumbar on the left side, thoracic spine on the left side, and cervical spine on the left side.
Okay.
And that should put everything back in place.
Okay.
since this is your first time chiropractic ever, most likely you're gonna have to come back and do a couple more sessions
Okay.
just to get this done because the muscles, they have their own memory and they're just gonna pull it back.
Right. Because I've been like this for so long.
Yeah. So because now your body think that this is a normal position.
Mm-hmm.
So I'm gonna basically what I do, it's not just putting things back in place. I'm reprogramming your musculoskeletal system and sending impulses through your peripheral system into the spinal cord back into the brain, saying this is a new position.
Right.
And then the muscle will say, no, this is a new position.
Yeah.
So there's gonna be a conflict.
Okay.
So basically, we're gonna be reprogramming your posture, and then usually it takes with you being young and rate of response is going to be quite fast.
Mm-hmm.
As I would say, 3 sessions should be enough at this point in time, and then
2 or 3, you said?
Yeah, I would say 3 to be on the safe side.
Wow, I didn't know it was gonna be that fast.
Yeah, I mean, if there is anything more serious like a disc protrusion, then it might take a little bit longer. I assume you don't have it.
Oh yeah.
Because you told me you don't have any shooting pain down your legs, so
Right.
that means there is no nerve irritation involved.
Okay.
So, with that being said, doesn't mean that you don't have a disc protrusion, but since you're young, you shouldn't have any problems.
Yeah.
I mean, and then basically, I'm gonna set you up for hit and steer in that machine.
Okay.
It's gonna help me to relax your muscles. Then I'm gonna adjust you
Okay.
the entire spine, and then after adjusting, I'm gonna see my massage therapist, and she's gonna reset all your muscles.
Perfect.
And then you come back on Monday. Friday will be closed.
Okay.
Because Thanksgiving.
Yeah, of course.
Again, Monday you can come back, and Wednesday, assuming you're available that time, and then we can kind of finish it off. You should be back to normal.
Sounds good.
In terms of lifting weights, I would hold off.
Okay.
At least for the time you're here, so your body has some time to kind of like to heal and rest.
Okay. Sounds good.
Any questions?
No, it sounds perfect.
All right.
Oh, do you have a restroom actually?
Yeah.
That you use for
How was it?
That was good.
Good?
Yeah.
Relaxing?
Yeah.
Alright. So what I'm gonna do first, I'm gonna adjust your middle back.
Okay.
And we'll go on with your side joint. And then sit you up or do your neck, and then we'll do the lumbar spine, okay?
Okay.
Okay, keep your hands down. Take a deep breath in. Out. Okay. Out. Okay. Out. Okay. Go on your side, please. Face me. Let me sleep on your side. Okay. You're from Korea originally?
No, I was teaching English.
Oh. Okay. I just heard on NPR that the president is being
It's
corrupted.
terrible.
It's like first female president, and she was involved in some big corruption scam. This way towards the wall. Yeah.
So.
This turn around. Put your leg over.
Okay.
Sit up.
Okay.
I'm like, wow, that's talking about North Korea. They crooked stuff, but this is like beyond.
Yeah.
Okay. Relax.
Oh.
Okay, there's a little bit here as well. Okay. Right. Okay. Stand up for a second, please. Okay. So go ahead and lie on your side facing this way.
Yep.
Apparently you guys do a good job teaching English over there. So we met a couple in Florida, was in Italy.
Yeah.
Naples. And they both spoke perfect English. They were from South Korea.
Oh yeah.
It's like, wow, that's impressive.
Yeah.
Okay, so stand on your feet. How does it feel?
Feels good.
Okay,
Yeah.
let me check your toes. Okay, look straight. Okay, what was the worst position that you did that was hurting you?
When I bent down to tie my
Okay,
shoes
go
or something.
ahead. Is it still there?
I can't feel it. I can't really feel it.
Okay,
Yeah.
well that's good. We're in the
Yeah.
right track.
Yeah.
All right, so let's go see my massage therapist, Gail. I'll
Mhm.
tell her what to do, and then we'll just go from there.
Perfect.